Hi, I'm Ron Lang, the Chief Executive Officer of CalCPA Health, CalCPA's Group Insurance Trust. And today we're going to be covering health savings accounts, participation and contribution, and some things about the market. So this is the agenda for the hour. We'll cover some HSA basics and then a whole list of rules and regulations that will go into varying degrees of detail. And then we'll finish up with some comments about the HSA market. So to the basics. To have an HSA plan, a health savings account, we need three components. There's an HSA administrator and a bank account or a custodian account. And you see the little bracket we have drawn there. That's because those two legal entities are usually one. So people like Mellon Bank and Health Equity are both banks and HSA administrators, so they provide that combined service. There are things in the market that are separate in those two areas, but typically people select one custodian bank that are integrated in one entity. And then you need a qualified high deductible health plan. HDHP is the abbreviation you'll see over most of the materials when you're looking at IRS documentation or materials from the industry. And then we have two flavors of HSA administration, standalone HSA administration and integrated HSAs have become available in the recent few years and are becoming increasingly popular. Well, what do we integrate with HSA administration? We integrate the claims, and most of those show up in the form of a debit card. And then for employers, we integrate the eligibility. So on the claim side, if you're on a standalone HSA, you incur a claim, you submit it to the HMA administrator either in paper or electronically, and the claim's in essence adjudicated again on your HSA account. With the integrated, the claims are shot to the HSA administrator electronically. You can set the account up to auto pay or pay on your approval or not pay unless you review it. And then, of course, you have the debit card where you can go and incur or pay for costs and then adjudicate the claim after. Let's move into the plan designs with the qualified high deductible health plan. So the IRS has set out regulations on what these plans have to be comprised of. So they have to have a minimum deductible for self-only coverage of $1,300. And the way it's referred to in the documentation is other than self-only coverage, which is family coverage. So they don't distinguish between employee plus spouse, employee plus children, those types of designations. It's either just single coverage or family coverage, self-only, other than self-only. The high deductible health plan cannot have any first dollar coverages, which means that nothing can be covered under the $1,300 deductible. Things like prescription drug plans or anything that's in a standalone basis, you can't have anything paid below that $1,300 deductible. You're self-insuring up to that amount. Now, the only exception for that is the Affordable Care Act preventative care mandates. So if you go in for your annual checkup, those are covered without consideration of the deductible. And then the IRS sets maximum out-of-pocket amounts. 2017, it's $6,550 for self-only and $13,100 for family. All of these amounts are inflation adjusted by the IRS annually, although some years they don't make an adjustment, but they are inflation adjusted by the IRS. Keep in mind that the Department of Health and Human Services, which is regulating the industry under the Affordable Care Act, has different limits on plans and different limits on out-of-pockets and deductibles. So you'll see variances, and if you are in just a regular high deductible health plan versus an HSA qualified high deductible health plan, you have to go by the IRS rules. And all these limits are in-network only. The regulations do not set limits or identify non-network limits. California last year passed a law or a regulation that requires embedded deductibles on and out-of-pocket costs on HSA plans, and actually on all plans in California. But they were typical in the HSA market nationally because of the IRS regulations. IRS regulations require an unembedded or a family deductible on the lower deductible plans. So let me give you an example. It's real easy to get bound up in the language embedded versus unembedded, but let's just take a simple example of a deductible. So if we have an individual deductible on an HSA plan of $3,000 and the aggregate family deductible is $6,000, each individual in an embedded scenario just needs to get to $3,000 before the plan starts paying benefits. In an unembedded contract, the entire family needs to get to $6,000 before any benefits are paid. So by going from unembedded to embedded, it increases the benefit level a little bit because each individual only has to get to the, in this example, the $3,000. But if there were 3 members of the family and they all had $2,000 of cost to get to the $6,000, well, then the benefits would kick in at that level. So there's an embedded individual deductible in the HSA plans in California. Typically, the HSA plan has the individual deductible, and in a family contract, that'll usually be 2 times the individual deductible. So if it's $1,700 for the individual, $3,400 for the family, that can vary, and that's not written in stone, but that's what we typically see in the market. And then some deductibles will go all the way up to the out-of-pocket limit of $6,550 and $13,100. Co-insurances can be anywhere, after the deductible, can be anywhere from 0 to 50%. Zeros used to be very commonplace in the market, but they're very hard to find now if they exist at all. Usually that co-insurance amount is 10, 20, 30% up to the out-of-pocket max. And then the out-of-pocket maxes vary greatly, but they're typically 3 times the deductible amount. We're starting to see drug copay plans come into play in excess of the deductibles. That didn't occur previously, so you can have a typical drug copay plan above the deductible. Of course, under the deductible, there is no drug copay plan allowed because that would be first dollar coverages. Let's move on to eligibility and the eligibility rules. And we'll go through these in some detail so that we can identify who's allowed to contribute to plans and who's allowed to participate. So the regulations have a definition of an eligible individual. An eligible individual is somebody that's allowed to make HSA contributions. So if we go through the list, they have to be an adult. They can't be claimed as a dependent on somebody else's tax return. They must have a qualified high deductible health plan. So you can't make HSA contributions unless you have that HDHP plan. And you can't have other coverage. We talked about that you can't have any other first dollar coverages. Well, you can't be covered by Medicare, Medicaid, the Veterans Administration over the last 90 days. You can't have access to an FSA, a flexible spending account, or a HRA, a health reimbursement arrangement, which has first dollar funds in them. And you, as I mentioned earlier, you can't have other insurance coverages like a drug plan or something along those lines that pays first dollar coverages. There are no income requirements for HSA plans, which I think is one of the not necessarily misunderstood, but one of the components that's missing from most people's general knowledge of HSA plans. You don't have to have a job. You don't have to be employed. You can have an HSA, a high deductible health plan, an HSA account without any income. You can make contributions from personal savings, from investments, from unemployment, from welfare benefits. You don't have to have a job or have W-2 income. And income does not affect HSA eligibility. The person does not have to file a tax return to be able to have HSA eligibility, although you would not be able to receive all the benefits of an HSA plan unless you're filing a tax return. Now, we talked about that you're not allowed to have Medicare, Medicaid, and other first dollar insurance coverages, but there are permitted insurance coverages that aren't related to your health plan or that have health coverages but are still allowed. So, for example, an auto plan could have medical coverages in it, but you're allowed to have that plan. Accident coverages, certainly dental, vision are medical coverages, but they're not relating to the major medical plans, so they're allowed disability insurance. Specific disease insurance, so if you bought an Aflac cancer policy at work, that's allowed to coexist with an HSA or a high deductible health plan. Hospital indemnity plans, they're not very prevalent anymore. Many years ago, decades ago, most health insurance was hospital indemnity plans, which pay a fixed payment per day of admission. Those are allowed to coexist. Long-term care insurance. And then in recent years, we've had a lot of worksite employee assistance programs and wellness programs that have become available. And those were a little bit problematic for the regulators. So what they've come out and said is if they do not pay significant medical benefits. So if you're at an employment wellness fair and you receive some test and that test was valued at say $50 or $75, they view that as not a significant medical benefit under your deductible, and those things are allowed. Identifying an account holder versus a policy holder. So you have an HSA account and you have an insurance policy holder. There's no requirement that the insurance policy or that the HSA account holder is the primary insured. So we'll talk about later married couples and how all that interacts, but if you have two people covered under an HSA insurance policy, one or both of those people can then have HSA accounts if they are eligible individuals. We talked married couples can have one or two accounts if both spouses are eligible, which is a very common situation. The total contributions cannot exceed the maximums. We're going to go in depth into the contributions later. As with IRAs, you're not allowed to have a joint account. Each individual has an account, or if they only have one account, it has to be in one person's name or the other. Usually, especially as people get older, it's advantageous to have two separate accounts because after age 55, there are catch-up contributions allowed, and you have to have two separate accounts to have one for each of those people. But there's no requirement to have two separate accounts if there are a married couple covered under the plan. The effective date, eligibility effective dates, are determined by the date the insurance policy, that high deductible health plan, goes into effect. Most insurance goes into effect on the first day of the month. There are employers out there that have the date of hire, although once again that has kind of gone out of favor. Usually employees are the first of the month after they get hired, or 30 days on the first of the month after they get hired. But in those situations where somebody does have an insurance policy that goes effective and it's not on the first of the month, they're allowed to make contributions to their HSA account starting the first of the month after their insurance policy went in force. So it's pretty simple. If you had an insurance policy that went into effect on, in this example, May 15th, you would be able to start contributing to your HSA on June 1st. Contributions. The limits are displayed on the page. For single coverage I'm using all 2017's numbers rather than showing the historical ones. So it's $3,350 for a single person. The age 55 catch-up is $1,000. That catch-up has not been inflation adjusted. The $3,350 and for family coverage, the $6,750 maximum contribution level, those are inflation adjusted by the IRS annually. So who can make these contributions into the HSA account? Well, obviously the individual account holder can, employers can, and then family members can. And the example we show on the screen is of where parents could contribute to the HSA account of a child, and there are other ways that people can contribute to other relatives' accounts. But generally speaking, it's individuals, their spouses, and their employers are contributing to these accounts. If you are eligible, or if an eligible individual, I'll try to keep using the language that the IRS uses, if you're eligible for the entire calendar year, then you can contribute the full amount that we were showing the 3350 and the 6750 plus the catch-up contributions. If you turn 55, the year that you turn 55, you can make the full $1,000 contribution. So if your birthday falls on any day in the year, if it's on December 20th, you can make the full 1,000. If it's on January 2nd, you can make the full 1,000. If eligibility, and this is it sounds like it wouldn't be typical, but if eligibility ends before December 1st, then you prorate your contributions for that year. So think of, let's just say somebody went effective on the first of a year. At some point in time, they're going to go on Medicare, and that date is typically not going to be the last day of the year. It's going to be the date that they turn 65 or retire, and so they are going to have a proration. And then anybody that loses coverage or decides to get out of a high deductible health plan in the middle of you change employers in the middle of the year, and the new employer doesn't offer an HSA compatible plan, so you would have a partial year on that. If you made excess contributions during the year, there is a penalty if they remain in your account, but you have until April 15th of the next year to pull those excess contributions out. So we'll have some examples of this, but if you over-contributed to the plan, for whatever reason, you weren't eligible for the entire year, you're allowed to pull those contributions back out without a penalty. And so let's get into one of those examples. So here we have Bob, and Bob went effective on January 1st and made his maximum contribution right away. You can make those contributions, as we said a couple slides ago, on any day of the month, at any time during the year once he's eligible. And so he went ahead and contributed on January 2nd the full amount, the $6,750. And they also had family coverage. On February 28th, his wife ends up enrolling in another plan, which was a non-HSA qualified plan, so he drops her off the coverage. And then on June 30th, Bob loses coverage, or terminates his coverage and does not elect COBRA. So we have to prorate Bob's year out. And so for January and February, the math is pretty simple. We divide the $6,750 by 12 months. And each month is that value. In 2017, it'll be $562.50. When he drops down to self-only coverage in March, the $33.50 divided by 12. So we just take the eligibility that he had. He had family coverage for the first 2 months. Then he had individual coverage for 4 months. The $22.41 is the total amount that he's allowed to contribute. We said at the beginning that he contributed $67.50. So he's got to pull $42.91.68 out of his account by April 15th of next year to avoid any penalties. If an individual is eligible on December 1st of a year, they're allowed to make the complete contributions for the entire year, the full contribution. This is called the last month rule, and a full contribution is allowed for the entire year. So this seems like a pretty good deal. So if you come on a plan in November or December, you get to make the full contribution to $33.50 or the $67.50 for the entire year. The caveat, though, is that you have to keep that coverage in force for the entire next year. So if we're in 2016 and we've got a partial year, we make the full contribution, even though we're not covered for 12 months. We have to keep that coverage in play for the entirety of 2017 for us to be able to qualify for that maximum contribution in 2016. If you don't keep it, well, it's called the testing period the next year, and and we'll go into what the testing periods are. So at the time of the contribution, you have to keep that, as I mentioned, keep it in force for the entire next year. If you fail to do that, you'll have to take the excess contributions out as income, and then you'll have a 10% penalty on the excess. So let's just say that we didn't keep the policy in force, and we'll go through a little example here. So on July 1st, Sally elects single HSA coverage through her employer, and before that date she didn't have HSA eligibility. On October 1st, she adds her husband, And so she makes the maximum family contribution of $67.50 because she was eligible on December 1st or before December 1st in this example. So to make that maximum contribution of $67.50, she must remain eligible for all of 2017, or otherwise she's subject to the penalty. In this example, she loses her job on January 31st of 17 and doesn't continue her coverage with COBRA, and so therefore she's going to be subject. She doesn't pass the test and is going to be subjected to the penalty. And so we show the calculation. So she had 3 months of single eligibility, so 1/12 of the $33.50. She had 3 months of family, which the prorated amount is $562.50. So she was allowed to make $24.98 in contributions. She actually made $67.50. So we have an excess. She has to take $4,225 out of the account and pay a penalty on a 10% penalty on that excess. So for family members, we talked about that we can have spouses and dependent children covered. If your spouse has other coverage, which is a very typical situation, they may have other coverage at work, it does not impact your HSA eligibility unless your spouse has FSA or HRA first dollars that could be used against your deductible. So when a few slides ago we had the other coverages that were allowed and those that were not allowed. Well, one of those coverages that does not allow you to be HSA eligible is that if your spouse's employer or your spouse through their other employer has FSA or HRA money that can be applied under your deductible, then you're not an eligible individual. So that's one of the things that can cause you to not be able to have an HSA account or contribute to an HSA account. The spouse's coverage, though, does not impact your contribution limit. So even if you're covering yourself or your spouse on a family HSA eligible plan, you can contribute the family maximum even though the spouse has other coverage. They're the ones that can't make the contribution. Dependent child's other coverage. This one comes up quite often. It does not impact the HSA eligibility, your HSA eligibility, even if the child has other coverage that's not HSA qualified. So you've got a child on a plan, they're getting out of college, they're still on your HSA plan, they get a job, they take coverage out at their work, or they had an FSA plan at their work that gives them first dollar coverages. It doesn't impact you or your HSA plan. And just remember also from a few slides ago that minor dependent children are never eligible to have their own HSA accounts. So we had about being dependent on somebody else's tax return and all of those criteria. So they're not able to have their own HSA account and make contributions, unless they had their own plan. But the expenses that your spouse and your children incur, if they're covered under a family HSA plan, you're allowed to get reimbursed or to use your HSA amounts for those expenses. One of the criteria that made you not an eligible individual was if you had Medicare. So obviously Medicare has first dollar coverages under the deductible, and you wouldn't be allowed to be participating in an HSA or making HSA contributions. If you have an HSA account and you turn 65 and go on Medicare, you never lose your HSA money. That money is there for all of your out-of-pocket expenses that relate to your medical care. But if you're on Medicare, you cannot continue to make HSA contributions. If your spouse is covered under an HSA eligible plan, they can continue to make HSA contributions. Back a few slides ago, we talked about a husband and wife having separate HSA accounts. So in this situation, one goes on Medicare, the other one has family coverage under their HSA account. They can continue to make the $67.50 and catch-up contributions into their HSA account. The caveat is the spouse can use the HSA funds to pay for the spouse's medical expenses, but they can't pay Part B and D premiums with that money, even though he's not an HSA eligible individual. I'll just mention this rule, the age 26 rule. It's I think somewhat obscure, but it's a difference between the IRS and the Department of Health and Human Services rules. So it's possible to have a child on your plan who's up to age 26 and is so under the Affordable Care Act, children up to this age can stay on their parents' health plan. So they don't have to be a full-time student. They don't have to be living at home. They don't have to be tax dependent. They could be married. Those are differences with what the IRS is looking at for somebody to be eligible on or for reimbursement under an HSA plan. For example, if you're 24, you wouldn't be qualified under the HSA or the IRS rules. So just keep in mind the differences. Just because the child's on the plan doesn't mean you can use the HSA money to reimburse for the child's health care expenses. But the parents can still contribute the maximum family amount to the HSA. And so we just cite a little bit of the rule differences here. Many of you are probably familiar with the IRS definitions of a qualified dependent. And so there is a difference where the IRS is looking at somebody under age 24, where the Department of Health and Human Services allows people to stay on their parents' health plan until age 26. Domestic partner rules follow along. They can have one or two HSA accounts. There is this definition of a qualified or a qualifying relative that gets applied into domestic partners. The general practice is that both domestic partners open up an HSA account so that there's not any that the rules for reimbursement are just apparent then, and then also both people can do the catch up. So with domestic partners you could have one or two. It's generally recommended that they have two accounts. Well, let's take a little breather and review some of this and put some of the things that we talked about into the form of some quiz questions to make the points apparent and have some simple takeaways. So in question one, we've got a husband who has self-only HSA qualifying coverage, so they have a high deductible health plan with self-only coverage, and the wife has self-only HSA qualifying coverage. So who's eligible? Well, both are eligible, right? And if only the husband sets up an HSA, how much can he contribute? Well, he can contribute to $3,350 because the wife hasn't set up an HSA account and he has HSA self-only coverage. We move on to then if the husband has family HSA qualified coverage, and he and his wife are both on the plan, and the wife has self-only coverage, who's eligible? Well, of course, the husband is eligible because the wife does not have, she has non-HSA coverage. So she has first dollar coverages. He has a qualified plan with family coverage. How much can the husband contribute? And he can contribute the full family amount because the wife is covered under the plan. Once again, we have a husband that has self-only HSA qualifying coverage. The wife has non-HSA qualifying coverage that the husband and the kids are covered under her plan. So how much can the husband contribute to his HSA plan? And the answer is zero because he has first dollar coverages with the wife's plan, and therefore he is not an eligible individual to make HSA contributions. Question number 4. Once again, the husband has HSA qualifying family coverage, and the wife has HSA qualifying family coverage. if the wife sets up an HSA, if the wife sets up an HSA, how much can she contribute? Well, she can contribute the full family amount of $67.50. If they both set up accounts, which we talked about earlier, was probably the advantageous situation, especially after they get into their older ages for the catch-up contributions. How much can they each contribute? Well, they can contribute $67.50, but it's divided between the two of them. So however they divide that up, the family unit cannot contribute more than the $67.50. Question 5, the husband has HSA qualifying family coverage through his employer, and he's also enrolled in Medicare. And this is a very common situation that we see often. The wife, age 62, is retired, and she's covered under her husband's HSA qualified plan. How much can the husband contribute to the HSA plan? Well, we talked about a few slides ago that he has Medicare, so he's not an eligible individual. He can't contribute anything. How much can the wife contribute? Well, she's on the plan. Remember, we said it doesn't make any difference whether you're the policyholder or not. She can contribute $77.50. She can pick up the $1,000 catch-up, and she can also contribute the full family amount. Question 6, and we got a couple more of these. The husband has qualified family coverage through his employer that began on January of 2016. And he loses his job unexpectedly 9 months later on September 30th. The wife is not working, and she and their child are covered on the husband's plan. So we have the entire family unit covered under the husband's plan, and that coverage ends on September 30th after 9 months. Who's eligible to contribute to the HSA? Well, both the husband and wife are eligible to contribute because they're both covered under the family plan. And how much can they contribute between the two of them? Well, in this situation, we've got the prorated amount. So we take the $67.50, divide by 12, multiply by 9, and they can contribute $5,062.50. If they had contributed more than that, they would have by April 15th to get that money back out of the account without incurring the penalty. And question 7. The husband has self-only HSA qualified coverage through his employer that went effective on July 1st of a year, and the wife has non-HSA qualifying coverage through her employer. Who's eligible to contribute to the HSA? Well, the husband is because he has the HSA qualifying coverage and she has first dollar coverages through her employer. How much can the husband contribute? He can contribute $33.50, the full amount for the year, because he has self-only coverage, and he's on before December 1st of any year. You can make the full amount. So let's talk. That's the end of the questions for right now, and let's move over to employer participation, because most HSA plans, as we talked earlier, there's no income or there's no employment requirement, no income requirement. But most of the HSA plans are offered through employment, and employers are participating in some way, whether they're sponsoring the plan or setting them up, and many make contributions to those plans. So employers can make contributions to their employees' health savings accounts. The contributions are deductible as a business expense and are tax-free to the employee. And the contributions by employers for employees are all treated like any other contributions for health coverage. They're not counted as wages and income or payroll taxes. So they're, and also those contributions, as we talked a few slides ago, the employer and the employee contributions all go up to those limits that we talked, the $67.50 to $33.50. So it's a combination of the employer and the employee. I think on the slides earlier it said all participants. Well, in this case, the employer is contributing. If a husband and spouse are contributing, anybody that's contributing to that plan, it only goes up to those limits. The employer decides the frequency. So an employer could decide to fully fund the account on the first day of the year, or they could make a contribution every pay period, or every month, or every quarter, or at the end of the plan year. They decide what the frequency is going to be. They do need to allow the employees to be able to change their contributions at least once monthly. So if, for example, on an FSA plan, the employee is locked in and for the entire year on how they're making their contributions, the employee can change their contribution levels throughout the year on an HSA plan. And then the employer can choose the bank that they're going to be dealing with. We talked about the components of the plans, where we need a bank account, a custodian, and then we need a high deductible health plan. The employer, if they're making contributions, they can decide which bank and custodian that they're going to use for that particular plan. Once the money is deposited in that employee account, though, it belongs to the employee, and the employer cannot direct the employee as to how they're going to handle those funds at that point in time, which is different than an HRA and FSA accounts. There are contribution rules, and there are basically two sets of rules, and we'll go through those. The first one are the comparability rules. And so the comparability rules are used if the employer is not using a Section 125 plan. I would think that most employers that are doing this are using 125 plans because they're already using a 125 plan for their health insurance premium deductions and any other things that they're offering on a cafeteria basis. So, but for those employers that aren't, the IRS has set out these comparability rules. And really they're non-discrimination rules. And what they say is that if you're going to make HSA contributions, you have to make them the same across all your classes of employees. And they have to either be the same dollar amount or the same percentage of the deductible. And they have to be the same and they can vary by family coverage or single coverage. So what this comparability rule says is, if you're offering an HSA plan and it's got a $2,000 deductible, you can contribute $100 or you can contribute 10% of that single coverage, or for the family coverage you could contribute $200 or 20%, but it has to be uniform across. And they do allow some variations for full-time and part-time employment, collectively and non-collectively bargained employees, lower compensated versus higher compensated, as long as you're putting more for the lower compensated. And so employees that do not have HSA qualified coverage are not eligible and can be excluded from these rules. So this is the comparability rules. It's just so that employers that don't offer 125 plans don't make contributions that are skewed one way or the other. And then, of course, most people are using 125 plans, and that 125 has its own set of discrimination rules that takes this into account anyway. So, the 125 discrimination rules primarily make sure that highly compensated employees or the lower compensated employees are not discriminated against. And I think most of you are probably familiar with the Section 125 discrimination rules. Employees can contribute whether it's from a 125 plan by making payroll deductions. They can deposit their own funds through the payroll deduction to supplement any employer contribution, if there are employer contributions, up to the annual limits, and including the catch-up contributions. Obviously, if they're using a 125 plan, there are multiple payroll tax savings and immediate tax benefits to the employees for doing that. We just mentioned that there's no double dipping. So if an employee makes a payroll deduction for their HSA contributions, they cannot then go to their tax return and take an HSA deduction on their tax return. Matching contributions are allowed. So just like a 401k plan, if the employer were to say, I'm going to match 50 cents on the dollar or dollar for dollar into an HSA account, obviously up to the limits, you're certainly allowed to do that. And so we see that occurring often because a lot of these accounts are now getting labeled health IRAs or health 401ks because of the savings features in them. Well, a lot of our CPA firms are self-employed individuals, sole proprietors, small corporations, partnerships. And as in any of these plans, similar health plans, those individuals are not able to take the pre-tax deductions through the company or through payroll. And so here's an expansion of that. And once again, I think that many of you be familiar with this. So although you can't run it through the corporation or the partnership, you are allowed to take that HSA deduction on your tax return, above the line on your tax return. So it's just a matter of not being able to run it through the corp or the partnership. You run it through your personal tax return. But the tax benefits are still there in this situation. Obviously, there's a little bit more administration going on. But with our CPA firms, hopefully this is pretty simple record keeping and the way to do that. I want to move over to a little bit wrapping this all up into in what we'll call the HSA market. So the HSA market has been rapidly expanding, and we think that a lot of that, of course, has been brought on by healthcare inflation and the Affordable Care Act. But in 2015 alone, the volume of accounts increased 22%. So at this point in time, we have somewhere in excess of 16 million accounts and well over $30 billion in assets in HSAs. And we expect this to continue. If the Cadillac tax of the Affordable Care Act ever gets implemented, it's been moved back 2 years, we see that further HSA plans will come into vogue as the cost shifting continues, where employees are having greater out-of-pocket expenses. So the driving force between the HSA adoption is that employees are trying to pay out-of-pocket healthcare expenses with preferred tax dollars. And in the quote-unquote old days of maybe 3 or 5 years ago, a typical vehicle to do that was a flexible spending arrangement at the employer, where the employee set some money aside on a tax-free basis and was able to use that for some minor healthcare expenses. Well, the FSA limits have been dropped significantly, and it has a use it or lose it provision, which doesn't allow for putting that you're putting your money at risk, and so if you don't know exactly what your health expenses are going to be, it isn't as advantageous as paying for those expenses with a health savings account. And then also an FSA is an annual basis. It's not a savings vehicle. When you put money into an HSA, that stays with you until you spend it, or if you took it out of the account. But if the advantage is that you will never pay taxes on that money if you use it for health care expenses. So it allows you to save for unknown and uninsured health care expenses, and it also follows you into retirement. And we'll talk about the retirement aspects of it here in a minute. So, but what's kind of the trade-off here? Well, the employee is assuming a greater risk for a lower health insurance premium, and that's the trade-off. So you've got a vehicle that's taxed advantage that you can save for the future, but you also are at risk. The HSA, in addition, has what we call a triple tax advantage. So you get a tax deduction when you put money into the HSA account. There's tax-free investment compounding, so these monies can be invested. Most of the vendors have mutual funds that you can select from, just like a 401k or IRA. And then you get tax-free withdrawals if they're for healthcare expenses. If you don't use it for healthcare expenses, the withdrawals are treated very similar to an IRA 401k. There are not any mandatory withdrawals, but you do have income and penalties if you made early withdrawals. But the idea that if you use this for health expenses, that this is money you'll never pay taxes on. So what are the disadvantages? Well, I mentioned that you're self-insuring. So you're going to have a higher deductible, you're going to have higher out-of-pocket costs. There are cash flow issues. So if you have a traditional insurance policy and you have a big claim in January, The health insurance policy takes care of that, where with an HSA on a cash flow basis, you may have to come up with some money in earlier in the year, or if you're making a payroll contribution, the money hasn't accumulated in the account yet. And always with HSAs, the first year or the first 2 years are the most difficult because of the initial account funding. In other words, when you start an HSA account, you have zero balance. You've got to start putting money into that account, and it takes a while to get that account balance built up. At the same time, you're taking on greater risk with your higher deductible plan. The administration, there is a little bit more work involved in administering on the employee's part, on the employer's part, an HSA plan versus a traditional plan. So you do have to pay attention to your claims. You have to, if you're set up to authorize your claims or get reimbursements or paying your providers, you are involved in that. And then there is a little bit more involved on your tax returns, depending on how you're funding your HSA plan and how you're accumulating the funds there. And then another disadvantage is that California and 2 other states do not recognize HSAs. So all of the tax advantages are in California are at the federal level, and it still makes it worthwhile to have an HSA account, but California, you don't have the tax preferences that you would see in other states that recognize HSAs. So healthcare and retirement, this has become a very hot topic, and HSA plans, as I mentioned, stay with individuals through job changes and then into retirement. And so how much money do you need? Well, it all depends on how long you're going to live. There's a lot of folks that think that well, as soon as I turn 65, I'm on Medicare and everything's taken care of. Well, for the most part, Medicare Part A premiums are taken care of, but you still have to pay B and D or C, depending on which you choose. And Medicare doesn't address dental and vision, and there are still out-of-pocket costs that go associated with all these things. So the estimates that we're using from the people that are supposed to know is that if you're retiring today with a life expectancy of somewhere to make it to, say, 85, you're going to need around $200,000. And of course, that depends on how well or sick you are or how much of a utilization, but you still have these premiums you have to pay, and you're still going to have out-of-pocket medical costs. So the HSA can be a valuable tool in hitting retirement with money in one of these accounts to take care of this estimated $200,000 as you go into retirement. So where do we think HSAs are in the future? Well, as we mentioned, if the Cadillac tax comes into play, we think we'll see another big boom in HSA accounts. About 22% increase last year is a significant increase anyway. So cost sharing will continue to increase. Out-of-pocket costs will continue to increase. Employees and employers will seek ways to be able to take care of that with lower premiums and paying with tax-deferred dollars. Retirement, healthcare costs are going to continue are expected to continue to rise, and the HSA is a mechanism to address that. And then, of course, the HSA stays with people through job changes. Very few people are getting a job and keeping that for their entire career. So once they get that money in the account, they never lose it. It stays with them, and they are allowed to invest in the vehicles of their choosing. Well, in this short time, we can't possibly get through all of the nuances of HSA accounts, but we've tried to hit upon the things that typically come up. We do have a portion of our website that's dedicated to HSA accounts. There's a variety of information there. There's handbooks, there's Q's and A's, information on various aspects of HSAs with links to other sources. So at CalCPA Health, our website, /HSA, you can access that information, and you can always contact CalCPA Health if you have any questions about HSA plans or HSA accounts.